was founded in 2009, unifying 3 of the most progressive organizations in the United States: the California Nurses Association, National Nurses Organization Committee, United American Nurses, and Massachusetts Nurses Association. It now has close to 185,000 members in every state. It's the largest union and professional association of registered nurses in United States history, and represents almost 7,000 registered nurses right here in 15 Florida hospitals. NNU affiliated members are leading advocates of guaranteed health care by expanding and updating Medicare to cover all. For negotiating many of the best collective bargaining contracts for RNs in the nation they're responsible for, and for the sponsorship and initiative, legislation, and regulatory protection for patients and nurses. It is my pleasure to introduce to you, from nurses Whitney, Chris, Whitney, no?
Cindy Flach.
I'm so sorry. It is my distinct pleasure to introduce Cindy Flach from NNU.
She's a lot taller than I am. Yeah, in the sun a little bit, right? I think so. Thank you for coming out tonight. NNU is an organization of 185,000 RNs across the country, 8,000 here in Florida. Our organization is committed to independent political action, meaning we engage in politics on issues that are important to RNs, patients, and public health. We have a political program based on nurses' values and focus our attention on those values. First, we know, based on the science of healthcare and the experience we have in California, that mandated RN to patient ratios saves lives and saves money. This is a bedrock issue for us. Another core principle is access to healthcare. Studies vary, but it is estimated that somewhere between 20,000 and 45,000 people die each year because of lack of health insurance, and I'm sure quite a few of us can relate to that for their own families. Even under the healthcare reform of ACA, there's still over 33 million uninsured people in this country. It's a travesty. This number gets worse if ACA is repealed without the proper solution of Medicare for all. As an organization, we don't believe that the reform of ACA was enough to solve the problem. We have always supported and continue to support Medicare for all, or single-payer healthcare. People always ask, but how would you pay for it? Medicare for all would be funded by savings obtained from replacing today's inefficient, profit-oriented system that does not care about people, with a single non-profit public payer, and by modest new taxes based on the ability to pay. Premiums would disappear. Can you imagine that? 85% of households would save money. Under a Medicare for all type of single-payer system, all Americans would be covered for all medically necessary services. Doctors, hospitals, preventative care, long-term care, mental health services, reproductive health care, dental, vision, prescription drug, medical supply costs. It's not utopia. Patients would no longer face financial barriers to care, such as co-pays and deductibles, and would retain free choice of doctors and hospital. Doctors would regain autonomy over patient care. Another method of funding, and something NNU has worked on, would generate $350 billion a year, only a portion of which would be necessary to fund a rational, fair healthcare system, like single payer. The Robin Hood tax is a 0.5% tax on Wall Street transactions. We care about Main Street, not Wall Street, right? We figure we all pay sales tax. Why not the richest of the rich pay their fair share too? RNs in hospitals regularly see patients that are sicker than they need to be. Care being delayed because of a lack of insurance. Nutrition not always being good. Lack of adequate housing. Living in areas with environmental degradation. These are factors that are caused by failure to institute comprehensive policy that provides access to health care and a failure to provide minimum standards of living for people living in poverty. This isn't a partisan issue, this is not a political issue, this is a human issue. That is, to my mind, shameful that the richest country in the world has these sorts of problems. These problems could be simply eliminated with the financing from the Robin Hood tax. Just one other small example of how else that money could be used for public health. Currently, $1 billion a year is spent on research for an HIV cure, out of $20 billion spent totally. That is because the cost of care is so high. Research is showing some exciting breakthroughs, and the possibility of a cure is on the horizon. Imagine if we took only $10 billion of the $350 billion generated by the Robin Hood tax and found a cure 10 times faster. Nurses work to fight environmental degradation. Clean water, clean air are essential to life. Efforts to increase fracking and the increased number of pipelines destroy clean water and clean air that we need to live. This is preventative health care. We have been on the front line of opposing the Dakota Access Pipeline and the Sabal Trail Pipeline here in Florida. We also believe it is essential to support collective bargaining. So-called right-to-work states, it doesn't mean that we don't have rights, of which there are now 28 in every state in the American South, including Florida, which we call open shop states. Right to work is a misnomer. We don't really like to use that word. Standards of living are lower in each one of these open shop states. There's a direct correlation between these facts. Wages are lower, access to health care is lower, poverty rates are higher, infant mortality rates higher. These states invest less in elementary and secondary education and workplace fatalities. This is not a record to aspire to. I'm a proud Southerner, I'm sure some of y'all are too. We must have a robust workplace democracy and a powerful movement of workers to oppose these ills. This is what only collective bargaining can provide. For nurses, collective bargaining provides the ability to strongly advocate for patients without fear of retaliation. A funny thing about nursing is, a nurse is required to advocate for her patients by licensing laws in every state. However, employers are free to fire nurses for doing exactly that, for advocating for their patients. Nurses are placed in the awkward, uncomfortable position of choosing between protecting his or her job or protecting a license. Because we can be sure that if nurses does something to cause harm to the patient, even the best employer, the nurse is the one that's going to lose her job. The nurse carries that liability, not the employer. Only collective bargaining protects nurses from this inherent contradiction at work. All of these issues and concerns of the nurses are now at risk under the new administration in DC. Martin Luther King Jr. said that the moral arc of the universe is long, but it bends towards justice. But he also said that only happens when committed individuals make sacrifices necessary to force the change. That's us here today. We will fight for a just and fair society.